and welcome back to Nature's Divine Healing on Demand. I'm Kiana Del Rey, a holistic healer and certified health coach, here today with Renee Patterson, a genuine warrior of chronic illness and chronic pain. And today I want to give you guys a deep look into what chronic illness truly looks like with Renee. So I'm super excited to have you all here. Let's get to it, shall we? Super exciting to have you here today, Renee, and to have you be a part of the show and to really just share your story with us. I really would love to start this episode with you just really telling the listeners like where you're from, who you are, what your career experience is, and all about you.
Okay, thank you so much for having me, Kiana. I really appreciate it. It's an opportunity to talk about my chronic illnesses as well as the what I'm doing about them, so that maybe that can help someone else. I'm from Texas, Houston area, and I have been suffering with chronic illness for about 8 years now, and mostly the one that takes, you know, how the squeaky wheel gets this oil is my chronic illness of pain. And with that, I've been learning some different ways, or taking myself through opportunity to learn different ways to deal with pain using holistic methods, Eastern and Western medicine, anything that can give me relief. It's something that I'm still exploring. Some things are better than others. Some things really are a matter of combination, being able to keep that up. But unfortunately, the different doctor programs don't really work together. So it's something that we can also work toward as well. I think, did I get all your questions on that one, or should I list out some illnesses for you? Some more illnesses.
Yeah, you can definitely tell everyone about your diagnoses and maybe like when you were diagnosed with these illnesses as well.
Okay, well, sure. The chronic pain was diagnosed in 2014. That's at the same time that my neuropathy was diagnosed. And neuropathy is the loss of feeling in your nerves. And the nerves that you need the most, of course, I guess we all need all of them the most, but what seems to be the most is your feet, to be able to walk, the senses around your calves, where you kind of know where there's an object, even if you're not looking, but your senses are picking that up. My hands have neuropathy as well, not being able to feel objects. If you think about putting your finger on a hot stove, and where you may jump back of your normal feeling of with your nerves, it takes me a second, a little beat, and then usually that's a burn for me. So it comes up in some kind of other way to need to be relieved. So neuropathy is the overall overreaching part of my disabilities. Then I get into dealing with COPD, which is the lungs, scarring on the lungs because of being intubated when I was in a coma. I have had congestive heart failure twice. And yes, that's what you see in the movies all the time, where they say, you know, clear with paddles. And that was something forever. I'll have to say that about my heart, that it stopped twice. And also dealing with lymphedema, which is the body's ability to drain the excess water and waste out of your body, gets backed up. So you may see someone and they have large calves, and they're having trouble walking. And sometimes it's with your arms, that you have an engorged arm in one side and not the other. Those are ways to identify problems with the lymphedema system. Most of the time, people who are have gone through cancer will suffer through a bout of lymphedema as well, because the body can't support all the waste and draw it out at one time. So that's one of the those are the largest ones. And since my last one, the big would be worth talking about is my spine. I have a crack on the L4 and L2, and instead of getting surgery, I'm trying to opt for any other type of treatment that will possibly take uh, the the issue away where it's causing me to bend forward. So those are the top ones.
So many uphill battles for you, but you handle it with grace and a smile on your face. And that's kind of the story of chronic people who live with chronic conditions, right? A lot of us, they see us on our good days, because when we're not feeling good, we're at home hiding from the world. And so a lot of people will say things like, you don't look sick, or that you don't always look the way that they think that you should look when you're chronically ill. So I really love you sharing everything that you've shared with us so far. And so I'm curious, a lot of people with chronic conditions find themselves on in a lifestyle where they really just have to take a lot of medication. So are you someone who takes medication? And if so, about how many medications do you have to take per day?
Sure, I am a person that takes a lot of medication. It's not as much as it used to be. I'm down to maybe out of the types of medication, there are um, 11, but 2 of those I take 3 times a day. So the medication has decreased, but some of them, the actual dosage has increased as my pain continues on, because it just moves through the body differently as it picks up more and more areas to find painful for you. Um, right, you're absolutely right about the having a smile on your face. You have to, in order to continue to live your life with the amount of level of joy and acceptance that you can. When you're down and out, like you said, also, we're not going to get on any type of podcast or television shows if we don't have to, because it's just something that you have to quietly deal with, and it may mean that you need to be around certain items during the day that you can't take with you, or be on screen with something like that.
I always do this thing where I mute myself so I don't make any noise while the other person's talking, and then I start talking and I'm muted. So silly Kiana. I was just saying that I really loved your share on that, because I know in my own experience, in my worst of times, there was a point in time in my own life where I was having to take 13 medications twice a day. It was 26 pills. And to finally be in a place where I'm only taking one medication seems like crazy to me. And like, so I completely empathize with what you're talking about. People have no idea. And when you're chronically ill, sometimes you're like, did I take that medication today? Like you're like, you're trying to keep track of all of it. And it can be really difficult. And people don't know the struggles and some of the quirky things that people with chronic conditions deal with. And so that's why I love having you on the show today, to really kind of blow a lid off what a lifestyle with chronic illness looks like. So one of the things that people don't know is how often people with chronic conditions are going to the doctor. Maybe they're being shuffled around from referral to referral to referral, trying to get a diagnosis and things like that. So I'm curious, how often do you find yourself going to the doctor, and do you see different specialists and things like that?
Yes, I go to the doctor usually at least one appointment a week. Depending on what that doctor has to say, then it starts to increase from there. If I have to go see another doctor, or if I need to do another procedure to check in on whatever the doctor is trying to to assess. But yes, I have, gosh, 9 doctors, and I think I'm going to be picking up another one so that I can deal with the other part of the pain that I was talking about. It's another surgeon. So I do see pulmonologists, cardiologists. I have 2 of those, hematologist, uh, the oh gosh, there's always somebody to say. Of course, my primary care physician, my osteo, the rheumatologist, dealing with the osteoarthritis and the inflammation arthritis, and that's something people don't usually know, is that there are more than one kinds of arthritis, instead of just the rheumatoid and osteo that we always talk about. I have a therapist, of course, because who can deal with all of this and not talk to somebody about it, have to download. And then that leads me to a psychologist as well. So, because I also suffer from depression.
I really love how you gave a clear and distinctive picture of kind of the treatment team that you're working with to really improve your health, and how it really takes a village to be able to understand. Do you feel like the communication between all of these doctors are happening for the benefit of your care? Or do you feel like sometimes they're not communicating?
I do feel like the team, and I'm glad you used that word, the team that I'm working with is putting that into order, because it made a difference to be able to choose your team. And so when I understood what I was dealing with, at least overall, and then having to get down into more of the nitty gritty of what's going on, it made a difference that I chose doctors within the same hospital system, that I chose the same hospital to continue my treatments if I have to be checked into the hospital. And I usually have to at least once a quarter for one thing or another. I have to make sure that each doctor is talking to each other, and they do so through the portal system that is used in my hospital uses my chart. So it really is making sure that those records are available when I do go see the preferred specialist that I chose based on what I've read up about that specialist to see if that's who I want to see. I make sure that they're within the system as well. And then that when I have my appointment with them, they already know they have my records because they're part of the same system, so they have access to it.
That's amazing. I feel like sometimes it can be difficult to make sure that the people are communicating. And what I've found in my experience is that a lot of doctors aren't necessarily reading the documentation until they're walking right into your appointment, or sometimes right in your appointment. So I'm so glad that you've been able to choose your treatment team, because that's such an integral part of being able to be healed. Now I'm going to ask you a really interesting question, because the research suggests that when people aren't represented by doctors that look like them, sometimes their outcomes can be not favorable. So I'm wondering, do you feel like you're well represented in the 9 doctor team? Do you feel like all 9 of those doctors, there's a pretty mix of different ethnicities and backgrounds, and even expertise?
Actually, it's a great point, actually. The team I had initially, the one that was given to me, because I think I spoke to you already about this, that I was making choices. I wasn't making choices. I was just taking whatever I could get. I was needy. I needed to have someone help me with my problems. But when I understood my needs better and I made the decision to choose a team, that means that I now am a person that's more that knows what I need. And so I choose the right person. And sometimes that person does not look like me, and that's just fine. But you have to be open to that as well. When you have something that's going on with you that needs the care that it needs, it really shouldn't make a difference. And we would think that overarching, it shouldn't make a difference what someone looks like or seems to have a shared background with us. But sometimes it does, depending on what we're talking about. So I do have a doctor that looks like me. I have lots of women doctors. I have, and when I say lots, more than 50% of my doctors are women. I do have women that are, or doctors that are Caucasian, and also all the way to, from China. Actual, that's the ones area that I think that I can say that it really just mattered to me what they could do for me instead of, how can I just get somebody there that's a cardiologist? No, I need to know what you can do for me. And whatever they choose, whatever they look like, it wasn't what I led with, but it did matter to me that I had people who I could understand and who could understand me. And so that sometimes doesn't necessarily mean we're talking without an accent or with an accent. Sometimes you're not talking with an accent. We just are talking past each other. Identifying that and understanding that that's what's, sometimes you figure it out after you leave the office, that wasn't a real good fit for me. And I've had doctors that are female that weren't good fits. So it just means leading with the issue, leading with what you want the outcome to be, and then you will find that people will fall into place, or the specialists will fall into place for you.
Yes, I really loved what you shared. Being able to find support among anyone and being open minded as well. I only ask this because I know that a lot of women and women of color deal with healthcare disparities that are so real for each and every one of us, and lots of other people deal with them as well, men as well. And so that being said, knowing that socioeconomic backgrounds, gender, race, all of these things play a role when we go to a doctor, even in being believed when we complain about symptoms. I was very curious to know about what your treatment team looked like and if you felt super supported by them. But I do have one last question on this topic. Do you ever feel like there was a time where you were trying to get answers and you felt very dismissed by your doctors when you brought the problem to their attention? And what would your advice be to people who might be facing the same issue?
I think, yes, I have. And I think that when you're facing that issue, you have to be honest with the doctor. It doesn't mean that you have to be confrontational. I did have a doctor that some of my chronic illnesses are based in geriatric medicine. It seems that that's usually where the route people are taking as we get older. Our bodies start breaking down. So I found that one doctor I was dealing with, if you looked in the office, were waiting to be seen, the average age may have been 75, but I didn't fit into that category. So I understood when he was talking to me, the things that he was saying. He was talking to me as if he didn't think I could quite understand. And then also I recognized that what I needed was some more testing and some, uh, uh, I guess I have to say another specialist that he would have to support me in that by referring me, because of some things I read online, and because he wasn't well read on that subject, he did not feel that that was something that I needed, and I disagreed with him and told him that I'm a person that's usually an early adopter to something that is about finding out the answer to an issue. And in this case, I didn't think that he was helping me with that, so I had to replace him.
Wow. Yeah. Sometimes you got to go get a second opinion and really say, you know what, you're not the one for me. So I loved your authentic share about that. So thank you so
And
much
yeah,
for,
Kiana, can I say one more thing, please?
yeah.
I'm sorry to cut you off, but you're right about the people of socioeconomic backgrounds that are not matching the common uh, background that the hospitals and doctors usually serve. Um, they there's a gap between people who have state-funded care and federally funded care. In between, you've got all these people with insurance that they get for their jobs. But in between those cracks, you have the people who are not insured because they may have a job but no insurance on the job. And then they may make too much money to be federally or state funded, or federally funded by Medicare if they're ill, but state funded by, usually federal funds are involved in that too. But you find those are the people that no matter where their address leads them, they still are finding themselves in the same position where the emergency room is the primary care physician versus the primary care physician that they would have on their team already. Because of not having insurance, you can't even begin to see someone. And it's a problem, as you're aware. When you leave the emergency room, they're always giving you support by telling you who the next doctor is that you should follow up with, not just their specialty, but also that their name and phone number. And so, unfortunately, a lot of these doctors don't see people based on their sliding scale on income, or that they don't give out free first appointments or consultations, or that they don't just have a grant that they offer certain people with the ability not to pay, or ability that we cannot pay. And that is a disability as well. So,
Yeah. Yeah. I mean, let's be real. Health insurance in this country is such a nightmare
yes,
here in the US that whether you're on Medicaid, like a state funded, you qualify due to not having enough income, you're still going to face some sort of prejudice there because there's only so much that Medicaid will pay out for certain services. So a doctor's going to get paid more if they see someone who's on a better insurance than you, and they really need your bed. So when you're in the hospital, they're kind of like, oh, let's get homegirl with Medicaid out of here. Let's get her fixed up and let's get her out of here. Let's get her stable. Let's get her out of here. So we can fill this bed with someone who's going to pay out more to be in it. So that's the hard reality. Then there's people who are in the middle. Maybe they do have insurance through the marketplace, but as an insurance agent, I will tell you that marketplace insurance that you're looking at for a single person, best rate out there that I've seen for a single person is $335 a month. It's what would be considered a silver package, not even gold. Okay.
right.
So because gold is $500 a month with a deductible. If you can get a good deductible of like $2,000, all the other deductibles are at like $6,680 type thing.
Right.
So it's still a nightmare with co-insurance of like 60-40, not good co-insurance, so as you still have to pay 40% of everything that comes out. So it's like when you think about this hitting a lot of American families, it's like, and like some people are blessed. They work for the state, they work for the government, and they do have government insurance. And those are the people that the hospital love to see coming. They love to see those military families coming because they know that they're going to get paid out the maximum that they can get paid out. Some people have private insurances because they work great jobs and they're doing great for themselves, and that's amazing. But it sucks that like health and wellness has been made to seem unattainable for some folks because they just genuinely don't have the funds to be able to walk into the doctor. And then you see a lot of things of like free clinics that only certain people qualify. Maybe you make too much to go to a free clinic. And then you see some sliding scale clinics out in some communities that, even when you make too much to qualify for their sliding scale, their max rate is still pretty expensive. I mean, I remember there was a point in my life where I was in this place where I couldn't afford health insurance and I couldn't get sliding scale. So I was paying the max payout at this clinic. And that was $120 anytime me or my ex-husband needed to go to the doctor. Like it was $120. That racks up. And you still have to pay for the medications. You still have to pay for the blood and lab work on top of it. So the cost of being healthy, it really does hit home. And so you've always got to think, where am I going to invest? Am I going to invest with the doctors, or am I going to invest at home with the nutrition, with the non-toxic living, with the natural remedies? So you always have to invest somewhere. It's just like
and definitely the social problems with that is that if you're not healthy, you can't work. If you can't work, you don't get paid. If you don't get paid, you can't pay for what you need. And it's this ugly cycle. And so when we're talking about whether we're going to have healthy Americans or not, we're talking about whether we're going to move this country forward or not.
Right.
I don't know that we want sick people trying to work on technology, because that means they have to hand it over every 2 hours to somebody else. They can't finish a project because they're ill. We need to talk about having healthy people doing jobs that we consider to be important in this country, like our doctors and nurses and all the people that we considered, what was the term we used? The people who we couldn't do without. Um, not first responders, but the, what?
Oh, the essential workers.
Essential workers, right. Yes. Essential workers, everybody has an essential job at this point, right? Especially when we had to go home, people became essential workers who weren't essential workers, if you would consider them in the day-to-day process of life. But, it was important that, the people who do the jobs that are hard to do, the ones that take the most physical labor, they can't be sick. You don't want to have your garbage guy trying to throw your garbage out, and then all of a sudden he can't get well enough to do it, pick up the trash. These things matter to us because we're outside now doing something with that. And it's like, if you think about it on your own personal level, what does it mean for me to have my neighbors be well? What does it mean for me to have people who are working in my neighborhood to be well? What does it mean for me to be well? And what am I putting out in my cul-de-sac? It makes a big difference. And when you think about who you are, where you live, and what you get to do.
Yes, Renee, I really thank you so much for bringing this to our attention, because you really can't work if you aren't doing well. And that's why health and wellness is so important. And so I want to ask you about your illness, and like, what all has your chronic illness, your chronic pain held you back from? What are you unable to do now that you're dealing with this?
That's a lot of things. The things that give me the most passion and excitement, I would have to say my grandbaby, my glam baby, I call her. Because I would like to just get up and go with her, take her out and doing certain events. It would mean that I needed to have someone else with me to do that. Since I'm using a walker, thankfully not in a wheelchair anymore, I would have to have my hands on her. She's only 3. So, I know what raising children is like, and it's best that I wouldn't perform something like that without having someone else with me. So that keeps me from doing something I think is most important to me right now. Going to movies, I love to go to the movies, but there's ways to do that too. Again, need someone with me. But I wouldn't mind having a date or two. That's fine.
Yeah, what a beautiful share, going to the movies. I know that you no longer work, right? So you are officially disabled now. Is that correct?
That's correct. Yeah.
But even though you're disabled and you haven't been able to work with this condition that you have, you've managed to still keep yourself busy with Able to Disabled. I would love for you to tell us about all the work that you're doing there.
Well, Able to Disabled is a new concept for me to put it forward into other people's hands. It is what I think I did for myself. And like I said, I've been dealing with my chronic illnesses as well as my diagnoses for 8 years, but in the last 3 years is when it became the most crucial for me to take charge of my own healthcare. So I've already explained earlier, that it was important that I started to have my own team, that I chose my own team. And then I had to organize my life around what I'm doing. I had to make some changes to my home so that I could get around, because I no longer wanted to deal with a wheelchair. So some doors needed to come off, some things in the restroom needed to be changed so that I could get myself together for the day properly on my own. And then I had to start creating opportunities for myself, like what we're doing now, which is talking about what this means, what we can do about it, what we can do for ourselves. And then I want to share my message about this on stages all across the world to talk to people, because this is one area of life that we all either maybe for a short amount of time or permanently enter into. As we get older, our bodies just break down, and we need to learn how to live differently. So that's what all we're really talking about is how am I going to live with this and still have a full life as much as I possibly can. So, these changes can be made, and there are also changes that people who are supporting disabled people have to make as well. So we just have to think of ourselves first. And then when we think of ourselves first, we usually end up helping others just by making sure that we show up.
Well, I'm so grateful that you showed up here today and sharing your light with us here on my channel. Oh my gosh, you're so amazing. And so one of the things I'm going to ask you is, what are your dreams, your hopes, your desires for your health and for Able the Disabled?
For my health, I've dreamed that there will be at least we'll get on the path to a cure for neuropathy. Most people who have neuropathy are diabetics, so it would mean fixing the problem with diabetes as well. I look forward to managing the pain, something that if we fix the chronic illnesses, the pain will be fixed as well. So that's what I look forward to. Able to Disable, I hope for this to be a long-lasting discussion. I hope for Able to Disable to also more so push the idea that if you care for the disabled, we're caring for everyone. People who we consider normal would be all under whatever we do for disabled people. So we would not miss a person. Right now, we lead with caring for the normal, and the disabled are an afterthought. So I'd like to see that if we flip that, and then we can start really discussing how we're going to build buildings, homes, and have more of an open effect for people who are working with disabilities, whether you see them or not.
I love that because, I shared with you in another conversation that I heard a very wise occupational therapist say that the thing that causes disabilities is not necessarily a defect or a condition, but an environment. And when we make environments that really embrace everybody's different types of abilities, like if we had environments where people who are nonverbal can communicate easily with people who are verbal, if we had environments where we're not just thinking about like wheelchair accessible ramps and entrances and bathrooms, but we're really thinking about how tall are the counters so that when a person in a wheelchair rolls up, how is a person in a wheelchair able to grab the things off the shelves? Like, what are we able to make the entire environment really conducive to make more people autonomous? And so I love what you shared, because when we bring awareness to the fact that all people can be empowered and truly, if we could drop ableism, right? Like that's the biggest thing, is that people are just like, oh honey, well, you're just not able. Well, I could be if we put certain things in place.
Yes.
If we put a plan in place, I could potentially be autonomous.
Exactly.
And so if we could take a different look at the way that we've looked at a lot of disabilities in our culture, whether they are physical disabilities, mental disabilities, cognitive disabilities, or developmental disabilities. These are all different things. The disability, there are so many different types of disability, and they don't all come in a wheelchair, folks. Sometimes people have PTSD and they're too anxious to be able to go out of the house and do certain things with their life. They can't hold work. They're disabled. Sometimes it could be that they're cognitively disabled because they have an intellectual disability, meaning that their IQ is lower.
Yeah.
and they just aren't able to. They don't have the same cognitive ability as maybe me and you. And so it's not that they aren't able, it's just that they don't have the same cognitive ability as me and you. And I think that if we could all reframe our thinking to take the word not able out of our vocabulary and to really think about how we can make a world that is inclusive for everyone, I think that we could gain a lot of traction there. So I love what you're doing and I love what you've come to share here today.
Thanks so much. I really appreciate you giving me an opportunity to talk with you, Kiana. It's been great.
Yes, I love, love, love it. So, everyone, make sure that you're following Renee on Instagram and make sure that if you don't have Instagram, that you're following her on Twitter. Today has been an absolutely amazing talk. And so, I really just want to close this talk with anything that you feel like you want to say about living with chronic illness, about being disabled, anything that you want to say to give hope to others who might be doing the same or in general.
Well, I thank you. And I would like to just say that if you have an opportunity to drop me a line and email on those two platforms, Twitter and Instagram, or you can reach me at Able to Disabled, or Renee at AbleToDisabled.com. Please drop me a message, give me a note about what's going on with you. I will try to definitely put you in touch with whatever resources necessary for you to get the help or support that you need. I like to do that.
You're such a helper and a connector, and I absolutely love that about you. And I'm so glad that we are connected.
Yeah.
And it's just been an absolute honor.
Thank you. It's for me as well.
Yes, we had such a great time on today's episode of Natural Healing on Demand. We are taking a deep look into chronic illness here with Renee Patterson, the founder of Able of the Disabled. And it was just really a great episode. I'm really glad for all the people who can watch this on replay. Definitely leave us a comment and let us know if you have any questions. And I'm super excited. If for any reason you have any health concerns that you're dealing with or you are looking to improve your health, feel free to contact me because I want to help you improve your health and wellness. So I'm super excited for this episode, and I hope that you all will take this look into chronic illness. If it's you, leave us a comment and note. We'll say, I'm dealing with a similar thing. I have this condition. My entire life revolves around it. And if it's not you and you're just someone who wants to lose weight, continue to follow this channel because there's always great nuggets here on health, wellness, and everything in between. So I'm super excited. And I just want to end with this short clip. Amazing. So I'm so glad that I got to be able to connect with you guys here. And until next time.